Today we're here at the Palm Beach Plastic Surgery Institute. I'm here with Dr. Edward Davidson. Dr. Davidson, thanks for having us here today.
Glad to have you here. Welcome.
We're so excited to learn about the practice. Tell me a little bit about the procedures here.
So we're a plastic surgery practice. We specialize in facial reconstruction as well as facial rejuvenation. So I'm a craniofacial plastic surgeon, so I operate almost exclusively on the face, whether it's facial reconstruction for trauma or patients with differences from birth, and then obviously facial cosmetic surgery as well. So facelift, rhinoplasty, blepharoplasty are most common procedures that we perform. So talking about blepharoplasty or eyelid surgery, if you look at this lady, classically she shows those changes we see in the upper lids where she's got this excess skin here, can kind of affect her ability to put makeup on that upper lid skin. And you can see there's this crepery of that lower lid, and you have this fat pooching out, or the bag, and that creates a teardrop. Ideally, you don't want to see any lid-cheek junction. Then after surgery, that's what you have. She has a much more smoother transition from lid to cheek. This is a patient in late adolescence who had a rhinoplasty to improve the appearance of her nose. Like I said, you're thinking about it in terms of third, so that upper third, you're looking at from the side and the front. That's where she has a little bump, which is very common. After surgery, she wanted that taken down, and that's gone, and she has a more feminine, smaller nose. And this is a lady in her early 60s who had a facelift to rejuvenate her face. You're seeing this tissue that was once up here has descended. There's a little bit of jowling. You get deepening of the lines there, and you get a lot of sagging in the neck. And then after a facelift, what you end up with is that tissue's been lifted, there's no jowl anymore, and the neck's much tighter and smoother.
So tell me a little bit about the typical patient that comes here. Is it someone that's had a trauma or more looking for the cosmetic side of things?
Both really. And I think, sometimes when people think about reconstruction and cosmetic, they see it as this black and white thing, but it's really a continuum. And whether you're reconstructing someone's face after trauma or reconstructing a difference that a patient just happens to have been born with, or someone's coming from cosmetic treatment to enhance themselves, a lot of the principles are actually still the same. And actually, I really think of cosmetic surgery as a reconstruction, but you're not reconstructing after trauma or from a genetic difference. You're reconstructing a pathology, and that pathology is really just time and gravity, and that time and gravity has affected your tissues of your face, changed them in a certain way. And even though we think of it as cosmetic surgery, it's really reconstructing things back to how they were.
Walk me through the minute someone comes in here till they leave. How do you kind of guide them through the process?
So I think really one of the special things about this practice is that we're by design a small boutique, bespoke concierge practice. I really always speak to the team about making sure that patients feel like, I say, in the womb of this practice, that we're babying them a little bit, and that they feel loved and really looked after, and that we're empowering them with information to make decisions, helping them make decisions, and throughout the process, from when they initially reach out to us, through that initial consultation, or as many consultations as they need so they're on board with the specific plan that we come up with together, through surgery and treatment, through that post-operative period. I think my job is really to give people information and help them make decisions. So I think when you look at those three procedures that we talked about, facelift, rhinoplasty, and blepharoplasty, helping patients understand the differences they see in a language that allows us to actually make a diagnosis and then come up with a plan to reconstruct that issue and bring about the cosmetic result that they want.
So Dr. Davidson, tell me about the non-surgical procedures that you offer here, such as Botox.
Yep, so I think a key part of facial rejuvenation is not just surgery, but the non-invasive stuff. So Botox or neuromodulators that can soften some of the lines that are created by muscle. There's also dermal fillers as well, and medical grade skincare. And in my mind, these are all extremely important adjuncts to support a surgical result, both pre-surgically and after surgery. And then deciding on whether surgery's for you or whether you're a candidate for non-invasive therapies. I think, we talked about the areas of concern, but you also need to think about the severity. So I think for things that are very minimal or mild, you can camouflage it, but as things get more moderate or severe, you really need to anatomically correct it. And I think when you see a result that's suboptimal, it's when you're trying to get too much out of something that doesn't really have the power to deliver the result you want.
How do you want your patients to feel when they walk out of your office?
I want them to feel like they've had a great experience, that they're really happy that they've had this. And most of the time, patients are like that, and they sort of are glad that they have a result that they maybe didn't think they could have achieved, that's natural, that doesn't, good plastic surgery shouldn't look like plastic surgery. It should just look like a natural result, whether it's someone looking refreshed or looking younger, people saying, oh wow, you look great, like have you done something? Like that's kind of what the goal is, and patients obviously happy with their experience and kind of wishing that maybe they'd already done this sooner.